So I am super excited to have Dr. Scott Waltman here, and of course my co-founder Jesse Finkelstein from TheraHive for this awesome conversation about Socratic questioning and DBT. And so I'll let us do some intros. And I'm Dr. Alicia Smart, a licensed clinical psychologist, Linehan certified DBT clinician. I run a DBT center in California, and I'm also co-founder of TheraHive. And I'll pass it to Scott to let him introduce himself.
Oh, I'm so bad at introducing myself. So my name's Scott. I have a dog named Frankie. Hopefully she'll come join us because I love her so much. I'm a psychologist. I'm a CBT, a DBT therapist. I'm a bit of an amateur memist. I'm a fan of Socratic questioning, Stoicism. I'm currently president-elect of the Academy of Cognitive Behavioral Therapies and the International Association of CBT and various other CBT-related things. I'm a fan of modern integrative CBT.
Well, welcome. And Jesse, you want to say a few words about yourself?
My name is Jesse. After that, I'm not sure where I can go. I am a DBT therapist and co-founder of TheraHive. I'm a clinical psychologist and just all around curious person who's excited for this conversation.
Awesome.
Yeah.
Awesome. So I am going to be kind of managing questions. So for all of you who are joining, if you have questions about Socratic questioning, if you are a therapist who has questions about how you might apply some of this stuff, ask away. Or if you are just a curious person who wants to understand how you can apply this to yourself, feel free to put questions in the chat and I will field them. But we like to start all of our Instagram lives with a little mindfulness to get present. So I'm going to have Jesse lead us in a few moments of mindfulness and then jump in.
I think because some of the subject or content of what we're going to be talking about is about cognitions and thoughts, I thought we could just take a few moments and just practice a little mindfulness of thoughts. So I'm going to invite everyone who's listening, and Scott and Alicia, you too, if you want, you can just close your eyes or lower your gaze, whatever you feel comfortable with. And in this moment, allow yourself to just sort of feel connected, centered by following the breath, noticing the inhale, noticing the exhale. And as our minds wander, as they tend to do, allow that thought to float on by. And you can even imagine placing that thought on a cloud and just watching it just move across the sky. We're not holding on to thoughts, we're not pushing them away. We're simply noticing thoughts as thoughts. And when you're ready, we'll bring our attention back to this Instagram live and let's talk.
Great.
Fantastic.
Yeah. Thank you, Jesse.
My pleasure.
Thanks, Jesse.
Always nice to have a moment of kind of grounding into the moment. Being present.
Yeah, that was lovely. I had some friends join, so I had a moment of being like, oh my God, they're here. And then I was like, oh, we're being mindful. Just being mindful.
Just thoughts is thoughts. Friends arriving. Thought.
Mm-hmm.
Yeah.
Just thoughts is thoughts. Friends arriving. Thoughts in this. Thoughts floating in a cloud.
Absolutely.
So I figured we would get started by just talking a little bit about about Socratic questioning, just offering folks the basics.
Yeah. So
Would you mind?
Socratic questioning? Who's this Socrates guy? Like, what's the whole deal? I think sometimes the idea of Socratic questioning gets oversimplified to this idea of asking questions. Sometimes it gets conflated with this idea about asking open-ended questions, and people will think if you're asking good open-ended questions, then it's being Socratic. Socrates would ask like kind of a series of like closed-ended and open-ended questions. Um, Socrates, let me talk a little bit about him for a little bit. I'm not going to talk too much about him because I get lost in it and I love it so much. So it's essentially, Socrates is one of the most famous philosophers of all time. His whole deal was that he knew the limits of what he knew, and he tried to help people recognize what they didn't know. There's this idea that there's things we don't know, and there's things we don't know that we don't know. And this sort of double ignorance was something he was trying to help people overcome. And he developed a teaching method of teaching through asking questions and having like an ask and answer kind of format, which was different than just lecturing. And this changed things quite a bit. People both loved it and hated it, and he was ultimately killed for this. And he was besmirched by a play at the time that painted him as an atheist, which he wasn't. Different conversation. But anyway, so Socratic questioning is used in different settings in different ways, right? And so psychotherapeutically, we might use a type of Socratic method called the maieutic method or the midwife method. This idea about trying to help people give birth to their own thoughts. Like we're there as a clinician, as a coach, as a guide, but ultimately, like I want you to give birth to your own thoughts. I want you to learn to recognize your own truth and follow that, which is different than like the elentic method that like a lawyer might follow. Like if you were being deposed, they'd be focused on trying to see, are you being consistent? Are there any places where you're not being consistent? Therefore, you're untruthful. Therefore, you're wrong. So it can be adversarial or cooperative, which is interesting. To oversimplify it, the idea of as therapists is we want to think with our clients instead of think for them. We want people to learn how to find these answers on their own instead of needing us to be there for them. Because my clients are at least as smart as I am, often smarter. And if I can learn to do it, they can learn to do it. And so I want to help people I want to see it the way they see it, and I want to help us expand that point of view together.
So, yeah. Scott, like one of the tensions that I often find, and as a therapist, is it's like I have my own ideas around. I have my own ideas about like what people should be thinking or doing. And oftentimes I have a very strong urge to be very directive and be like, no, like, wait, that thought, no. And what you're highlighting here is one disadvantage to that is that we're not helping people develop the skills to develop that sort of self-interrogation, that sort of questioning that we would like them to do independently. Am I understanding that right?
Yeah, I like that. And I might even shift self-interrogation to just curiosity. You know, Socrates says philosophy begins in wonder. So just this wondrous, this curiosity for the way things are. So the goal of Socratic questioning isn't to learn to prove to myself that I'm really irrational and then like root out all these irrational thoughts and never be irrational ever. But the goal is just kind of mentally take a step back and ask yourself, why am I so upset right now? What am I telling myself? What's going on? I have an urge to burn my life down. Like, why is that? Am I seeing things correctly? And I think, you know, as you're saying, like, sometimes when you're asking as like a coach or a clinician or a friend, sometimes there's an urge to tell people, like, here's the way I see it. And every now and then, like, you need to do that, right? Every now and then you need to be like, look, this guy's obviously married. Like, let me tell you what's going on. Like, there's reasons why he can only see you during certain hours of the day. There's reasons why his phone only works when he's at work and not at home. It's pretty obvious. But that's not the majority of interactions, right? I think about like math, right? So it's important to find the right answers, but it's more important to learn how to find the right answers.
So there was a question in the chat that I want to bring in, and I'm going to actually tweak it a little bit, but keep most of it, which is about like, how would you describe how cognitive restructuring balances acceptance and change in cognitive restructuring? But I also would like you to maybe speak to how is cognitive restructuring different or similar to Socratic questioning?
Ooh, okay, I could talk for a few hours about this. So cognitive restructuring, right, is basically, hang on. Oh, my puppy was coming over and I was going to grab her. She likes to do this thing where she's like, she wants me to chase her. She'll come over. Anyway, so Socratic questioning, cognitive restructuring. Cognitive restructuring, basically, it means like learning to see things in different ways. It often is something that clinicians do to help people look to see things differently. It can be done. Here's my puppy. Look at her. Oh my gosh. Isn't she so
Oh my
cute?
God.
I
How
love her
old?
so
And
much. She's
name?
7 months old,
Oh.
and her name is Frankie, and she's a Schnauzer mix. And she's very cute. She hasn't teethed all the way, so she has 3 top fangs, which is just kind of noteworthy and interesting. And anyways, sorry.
So cute.
I have to mindfully be whenever I can because there's a lot happening in the world right now. So cognitive restructuring is kind of an umbrella term, right? So cognitive restructuring could involve like a therapist using Socratic questioning together with a client to evaluate what's going on for them. It could involve, don't drink my Kickstarter. It could involve like behavioral experiments. It could involve using thought records. It could involve self-inquiry or guided journaling or something like that. So it's kind of like a broad term. Sometimes CBT is kind of a victim of its own success. So it's really easy to repackage these like undergrad textbook ideas about CBT, this idea about just think more positive and you won't be upset, which is not what cognitive restructuring is. And so sometimes there's these like bastardized, pretty offensive and harmful ideas of like, if you could just learn to think really positively, then you wouldn't be upset. And you're only upset because of your thoughts. And if you could just change them to really positive thoughts, you'd be fine, which isn't what cognitive restructuring is meant to be. Right? If somebody's in a really bad situation, my goal isn't to make them feel good about the bad situation, right? If somebody's being traumatized or victimized or exploited, my goal is not to make them complicit and cow-eyed about what's going on. My goal is to help them see things clearly, recognize their options, see what they have choice over, and hopefully focus on improving the situation. So cognitive restructuring and acceptance, for somebody who's like big tent CBT like me, it's like 2 sides of like the same like instrument. So to me, it's not necessarily different. I mean, early on there were studies comparing like cognitive reappraisal and acceptance, and if we were trying to fight, I'd say every time cognitive reappraisal beats acceptance, every time cognitive reappraisal leads to a decrease in distress more than acceptance does. But then on the other side, we might say, well, the goal isn't always to decrease distress, right? The goal is sometimes to see things clearly and make wise decisions.
Right. Sometimes
To me,
it's a signal to tell you need to do something to change the situation.
Right.
Yeah.
Right. Does the emotion fit the facts, right? If we were doing our emotion regulation worksheets, exactly.
Yeah.
And then I think to me, acceptance is cognitive reappraisal, right? Because acceptance has to do with like me appraising what do I have control over, and then I'm going to focus on the serenity prayer, which is all it comes back to, right? I'm going to change what I can. I'm going to accept what I can. I'm going to hope to learn the difference and hope to do things differently.
Right. Could have. About radical acceptance, as you were saying that, right? If I'm saying it shouldn't be this way, it shouldn't be this way, or it's fair, and then I'm actually saying, oh, you know what, it is the way it is, or this is what's happening, this is the reality, that is a cognitive restructuring, but it's also an acceptance.
I think so. And I think to add a piece to it, I think oftentimes the challenge that we run into is like we have thoughts that are mostly true but a little distorted, right? Like I'm reading the situation mostly correctly, but then my emotional mind is sort of twisting it in a way where I'm viewing it as being more permanent than it has to be, and viewing myself as less powerful, less capable than I am. A second.
Can I ask a question about that? Because this is something that I
yes, it's your show. What do you want?
Struggle with, which is this, and maybe there's a dialectical tension here. I'm sure there is, as there are in all things. But like this idea of seeing reality accurately and sort of doing what's effective. And I think about, for instance, the check the facts skill. And there are times, and I think for some clients for whom like that question of, am I seeing things as they are, is too overwhelming or can cause too much perseveration or rumination. And so then I sort of swing to this other end and I'm like, well, who gives a crap what is quote unquote real or what the facts are? Maybe we just lean on what is effective, meaning like what thought is going to help you move towards your goals.
Yeah.
And I'm
So I
wondering if
think
there's a disadvantage to either pole.
there's always a disadvantage, right? That's the thing. We spent years going to grad school just to learn that the answer is always it depends, and we're like, we knew that before we came in. How is that always the answer? This is silly. Yeah, I think absolutely. There's always a disadvantage. I think part of it has to do with kind of order of operations, right? Because there's sometimes where like it's not the right time to really jump into evaluating the thoughts, and it's more important to focus on like getting regulated, getting grounded, getting soothed. Like if I'm boiling mad about something, I'm not going to sit down and like see is my thinking clear, because I personally I can't think clearly when I'm boiling mad. When I'm boiling mad, I'm fixated on like this is how I'm being wronged. This is what's unjust. This is what's happening. I'm going to burn it all down. And there might be some things that do need to be burned down, but I don't want to burn it. I don't want to burn myself down in the process. So I need to slow down, I need to get grounded and soothed so I can figure out, okay, so what's actually happening? How am I seeing things? Is this accurate? Is my emotion proportionate to the situation? Which is the whole, I mean, if you walk through kind of the whole emotion regulation module, right? So you're looking to see what's going on, you're seeing what's upsetting about the situation, you're checking the facts. If the facts are accurate, you're moving into problem solving. If the facts aren't accurate, then you're going to engage in opposite action. You're going to say, well, as Paul said in the chat, I'm not going to focus on changing my thoughts. I'm going to focus on changing my behavior. I don't know if I answered your question or not. I just get excited.
You did, and I still am sometimes left with like, and even in that, like, Marcia has that like really sort of nice flow diagram of like what you do. It fundamentally comes down to is my what like is act like in wise mind is acting on this behavior
Right.
effective, like
Yeah.
independent of the facts of the situation, is my urge effective? And actually this sort of leads into another question. I feel like we're just going to jump around, and
That's okay.
so
Keeps it interesting.
I'm interested in how many of the folks who I work with in DBT, rumination and intolerance of uncertainty and the tightness with which they hold on to thoughts can become almost like a target of treatment.
Oh,
And I'm
absolutely.
what was that?
So, absolutely.
And I'm sort of curious, like how we integrate Socratic questioning when maybe partly the goal is to sort of loosen that grip
on the like the rigidity on the thought.
Yeah.
Mm-hmm. Yeah, absolutely. Right. This comes up oftentimes when I'm doing trainings. I'll have somebody who's like an exposure therapist want me to do like Socratic questioning, like in lieu of like exposure or something like that, because they want to see like, will this replace what I do? And I'm always like, well, if you have something that works, like why would you replace it? Like I don't do like I love Socratic questioning, but I don't spend my entire day, my entire life, even all my sessions doing Socratic questioning, because that would be really annoying. And also like it's not necessary, right? Like it's important to be having like a discussion and a conversation and figuring out what's going on. Like you could have like a theoretical knowledge that, I need to tolerate uncertainty. You could have a theoretical knowledge of, my need to control is part of the reason I don't have control. I got really into Stoicism, and one of the things that comes out from Stoicism is focusing on controlling what you can and letting go of what you can't, which lines up really well with radical acceptance. But in the writings of the early Stoics, they talk about kind of this paradox where the more you try to control things you can't, the more you lose control of yourself. And isn't that beautiful? Use that in a session. Fantastic. Right there, your client's going to say, Jesse, you nailed it today. Little does he know it was Seneca, like 15, 1600
No one
years ago.
needs to know that. I mean, even if I said it was Seneca, I'd still look good. So it's all.
He still got points for that. You can say Seneca the Younger said, and I'll say, oh, Seneca the Younger. This guy gets it. This guy gets it. Yeah, but I think, but from my perspective, like Socratic processes is like process-oriented learning instead of like didactic-oriented learning. So that might be like a discussion. That might be like a behavioral experiment. That might be an exposure. But essentially, I'm highlighting with whoever I'm working with, like, here's the idea that's coming up. Like, let's test this out, right? There's an idea that I can't tolerate uncertainty. Like, we can retroactively look back and see how is that working for you, which is the Dr. Phil question, which is terrible that it's such a good question. It's such a good question.
I didn't
But
realize that was a Dr. Phil question, and now
yeah,
I have some self-judgments for the time
right.
that
It's
I've
a
used.
good
How's
question.
that? How's that working for you? That was the whole like first decade and a half of his career was just people would come on the show and they'd say stuff and he'd say, "Well, how's that working for you?" And then work was a pretty good question.
Yeah.
Of
I mean, it's
course,
about a question
they're right.
about it's a question about effectiveness. So, you know.
Yeah, question about effectiveness. Absolutely, absolutely. So I got off topic. So I think, I mean, so I had a session just, I don't want to share like information people I'm working with, but I came up in a session I was talking about today, kind of this paradox of the more somebody tries to have certainty, the more they become fixated on needing certainty. And oddly enough, like more checking, more control, more oversight leads to like doubting what you have. It leads to like it's never enough. And ultimately, like you have to control what you can and let go and just have some faith or trust or willingness because life's gonna happen either way, right? As the saying goes, you know, fate leads the willing and drags the unwilling.
Mm-hmm.
Let go or be dragged, as they say.
I saw another question come up around, is there a time where Socratic questioning may not be effective or helpful or wise? Like, when would you not want to use this?
Yeah, it's a good question. There's a lot of times I'm not using it. The truism is that, you know, the more severe the presentation, the better it is to start with behavioral strategies and before moving into cognitive strategies. Like if we look at like CBT for eating disorders, if somebody's medically underweight, I'm not going to spend a lot of time talking with them about like your core self-value and the way you see. I mean, that's an important thing to talk about, but like your brain isn't working right. You're malnourished. You need behaviorally, we got to get you eating. Behaviorally, we got to make these changes before we can move into it. If somebody has like a specific phobia, I could spend some time cognitively talking about like, are you catastrophizing? What's the most likely scenario? But you got to jump in the pool. There's not a way around it. I personally, I'm interlacing cognitive strategies, behavioral strategy. Like it's like if you've ever moved a piece of furniture that's too heavy for you to lift, and you kind of pick up one side and you wiggle it, and you like wiggle it, and you pick up the other side and wiggle it, and you kind of like walk it across the floor. Cognitively and behaviorally, that's how I work. In a session, we'll do a little bit of cognitive work to navigate, like negotiate a behavioral change. We'll see how it goes, and we'll navigate some cognitive change, and we'll kind of wiggle walk the person towards recovery, which I guess is a book I have to write next. Wiggle walk and CBT.
I was going to say, it should be an illustrated book, if anything.
Oh
Or
yeah, that's
children's
easier.
book.
Yeah.
That's easier. I know somebody who's good at illustrations. That's fantastic. That's funny.
I mean, it's got, like I have seen on, you know, I mean, obviously in your work, but also on Instagram, some very sort of clear, sort of at times like detailed steps you've offered folks when they are looking to apply the tools of Socratic questioning for themselves. So if like you are a client or a consumer of therapy or someone that is completely not in therapy and are looking to apply some of these skills for your own thinking, like what are some of the steps or things that you should be keeping in mind?
Oh, that's a fantastic question. And actually, the last two chapters of my Stoicism workbook are focused on just exactly that. Like, how do you do this on your own? It's a process, right? I think the first you need to kind of cultivate this like curiosity and this awareness and this willingness to look and see like what are the stories I tell myself and where do these come from. The very first step is knowing what to go after, right? Trying to slow down and figure out, like if we're talking about self-practice, we're trying to figure out what are the stories I tell myself, where do these come from, what are the situations in my life that have been formative, what are the relationships in my life that have been formative. From those, what did I learn about myself? Because you and I both have stories we tell ourselves about ourselves, and some of them are healthy and some of them aren't healthy. Some of them I am continually trying to let go of and then picking back up because they both serve me and don't serve me, which is the drop the rope exercise and act. But we've got to figure out like what's the story you tell yourself. And then from there, a good next step is just to lead with trying to understand the context. Curiously, like, how did this come to be? How does this make perfect sense? if we recognize that, we come by the stories we tell ourselves honestly. Like, how does it make sense? What was the context that it formed in? My oversimplified theory of cognitive restructuring is that things happen early on, and they're highly context dependent, but then we generalize into like a globalized way based on that. And if we can go and look at the context and then view it in context, then it's easier to see things more broadly, but then we still need to make the changes now. For example, hypothetically, let's just imagine that I grew up with a dad who was like nice but emotionally distant, and nothing I ever did was good enough for him, and I ended up being a psychologist.
Hypothetically.
Hypothetically, right? Like, and then like I'm working with my therapist, and they're saying, okay, so like nothing's ever good enough. Like, where did that start for you? And I might say, well, with my dad, like nothing was ever good enough. Blah 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 blah. And then at that young age, I think, well, because my dad has never praised me, I'm not good enough. And the therapist might say, well, tell me about your dad. Like, is your dad generally really nice to everybody and like really like complimentary and he just doesn't appreciate and praise you, or is he sort of just kind of like emotionally distant in general? And I might go, I've never thought about that. But my dad, he's very practical, but he's not very warm. He's the only person he's really warm to is our dog. And I'll say, that's actually pretty common, but is it possible that maybe when you were younger, like your dad was standoffish, not because like you weren't good enough, but he's just not a very warm guy? What if this was about him and not about you? And I might say, oh my God, are you fucking kidding me? I don't know if I'm allowed to swear on this or not.
Yeah.
But I say, oh my gosh, are you kidding me? And then I'll go, I'm going to think about that. I'm going to kind of chew on that for a little bit. And then I'm going to go and kind of recontextualize what happened. I'm going to think through, okay, now that I can see it, now that I've taken a step back from the story, I can see what happened in context and I can understand it in context. I can look to see, well, what are the ways that I've engaged in like self-fulfilling prophecies or vicious cycles? Have I been overcompensating, or have I been avoiding? Have I been trying to prove that I'm lovable by being really pleasing and like people pleasing and things like that? Or have I completely avoided people in general because I thought that they were garbage and terrible? And has what I've done, has that shaped what I got? And then have I made decisions based on the stories I tell myself, and have those decisions shaped a life that reinforces my belief? And then from there, you got to make some changes, right? You got to start taking risks. You got to start doing things that are uncomfortable. You got to let go of your control strategies and your avoid strategies. So step one is you got to figure out, what do I tell myself? And then you got to say, how does this make sense? And then you can take a step back and see, well, what do I not see? What do I not know? What am I missing? Mm-hmm. All right, what can I see now that I couldn't see then? What can I not see yet because I haven't tried it yet? And then I got to make some changes and then try and sew it together.
Scott,
Easy as that.
I find this so exciting.
Mm-hmm.
I've always wanted a user-friendly case conceptualization book, like teaching folks how to develop their own case conceptualization. And it sounds like that's kind of what you're offering, is like the very first step. And maybe this is not the language you would use, but okay, let's sort of identify some of these quote unquote core beliefs, or these beliefs that we hold about ourselves. And then it sounds like step number two is what is the origin of these beliefs? And then it seems like you threw in there maybe step 2A is okay, can we reflect on those early experiences, and maybe we can get a little bit more flexibility around how they came to be. Maybe we can inquire a little bit. And then it sounds like step 3 is, how are those beliefs impacting you today? And then step 4 is, okay, what are the behavioral experiments we want to do with this information?
Yeah. The only thing I would add is step 3, I would also have a piece about well, what am I missing? All right. So one of my first supervisors, Robin Shawcross, I don't know what happened to her, but Robin Shawcross, who I love so much and also I was so afraid of, when we were listening to my session, she would say to me, Scott, is this a blind spot or a dumb spot? And I didn't know what she meant. I thought she was calling me dumb, and I was I would shame spiral, and I was really, really bad. And it wasn't towards the end of the year, but I was like, what do you mean when you say that? And she said, is this something you don't see or something you don't know? Right? Because there's things that I can't see because of mood dependent memory, because of confirmation bias, because of all of these cognitive and social psychology and neuropsychological processes that affect we tend to see what we expect to see, and we tend to remember what we thought we were going to see. So the mind is nowhere near as accurate as we think it is. So is this something you're missing what you know, and I can help you remember it? Right? Like if I thought I was unlovable, you might say, well, Scott, you've been married for like almost 20 years now. Like you think you're unlovable. That's kind of weird. Like is this person staying with you out of spite or what's going on? And I might say, huh, that's kind of interesting. Yeah. I guess I'm not like an unlovable piece of crap. That's interesting. So that's like something I know, but I can't see. But on the other side, we might say, like, is it something that you don't know yet because you haven't experienced it, right? If I have a fear of failing, so I've never really tried because quitting feels better than failing, I don't really know what I'm capable of. I've never really gone for it. So part of it is a process of gathering new evidence, behavioral experiments, and part of it is like reflecting on what are my blind spots. If you can identify what's the story I tell myself, and you can identify where are the places that this shows up in my life right now, you can learn to see what are my filters, right? If I think I'm not good enough, then I'm gonna learn to watch for evidence that confirms what I think is going to happen, and then you can ask yourself, well, what are the things I'm not looking for? What are the places that I might be missing? Well, I might be missing the places I am good enough. I might be missing the places I am successful. I might be missing the places that the world is not complete garbage. And if I can start watching for those things, I can find that actually there's a lot that I totally miss, right? There's a lot of beautiful and wonderful things that happen that I completely ignore because I'm so lost in this automatic pilot story of like, this is the way it is. This is the way it is. This is the way it is.
Yeah, I'm really appreciating how well this matches for me with DBT, because DBT is my specialty, so I'm like very all the time about like what is being left out. You know, that question that we ask in DBT, especially around chain analysis and really understanding how someone got to a specific point or like what's getting in the way to change behavior. And to your point, Jesse, about case conceptualization, I'm going to make a plug for you, Scott, on your book.
Oh, thank you.
I found it so wonderfully refreshing how clear it made making case conceptualization. I mean, more than any other book I read in grad school, like I just felt like it was just like, oh, like this makes it so easy, like just simpler and easier for me to like do it quickly and then teach my supervisees how to do it quickly. I don't know. It just brought it together for me in a way that was like, you know what? I really like this format.
That's very nice. I, of course, am very embarrassed, but that's very nice. I appreciate it.
So I did the book. I have lots I didn't know, so it's like I totally geeked out on it. It was great.
I like to reduce things. And I am sort of like I wonder if there's got like this like blind spots and dumb spots. And so it's like I have like this, I wonder if like blind spots are where sort of the cognitive interventions can kind of take place. And the dumb spots are where some of those behavioral interventions can kind of like, I wonder if we can sort of conceptualize it around.
Yeah, the way I might think about it, like if you were doing Christine Podesky's 7-column thought record, right? What evidence for, evidence against? Evidence against is the blind spots. Here's things that you know, but you're not seeing because you're stuck in your story. What do you not know is going to be behavioral experiments. These are the things you haven't tried yet. Essentially, if we were to drop your control strategies, your avoid strategies, if we were to do some ERP on ourselves, what would we find?
I like that.
There was a question about in the chat around whether to use the Socratic questioning to evaluate thought, like when you're like content versus like working with cognitive process.
Oh, I love that question. That's fantastic. Okay. Sometimes I get really excited and I talk really fast, which is faster than normal, which is normally pretty fast. I gotta try and not talk too fast. I think both are good, right? I think both are good. I think so. There's a question of like, Socratically, like, should we be focusing on evaluating the specific thoughts that people are having, right? So if something happens during the day and I tell myself like, Scott, you're such an idiot, like I can't believe you did that, I could evaluate that thought. Well, am I an idiot? Is this true? But then processes we can be looking at like, if I keep getting to these places, are there certain pitfalls, thinking styles, thinking traps, schema, irrational beliefs that we might get into. If you think like Beck and Ellis for a little bit, so Beck is focused on like, is the thought true? Let's evaluate the thought and see what's going on. Ellis is focusing on like, is um, is your thinking overly rigid, right? Do you have like rigid demands for the way things are? Are you in a place of non-acceptance? Do you have like demandingness or frustration intolerance? Are you person rating? Are you alphalizing? And this is more of like a behavior in a sense, like a mental behavior. And I think Socratically we can absolutely work with both. I think the first step is going to be trying to track what's happening, being curious about it, and then whatever patterns I'm seeing if I'm working on myself or we're both seeing if I'm working with somebody, we're going to be curious about what keeps coming up. Right? If there's a pattern of something unpleasant happens and then I gnaw on it in a way where it becomes more unpleasant than it needs to be, if I'm awfulizing, if I'm taking something bad and making it worse by picking my scabs emotionally, we might say, well, we have a word for this. We call this awfulizing. This is where we take something unpleasant and we hold on to it in a way where it becomes even more unpleasant. And let's be curious about like, why might you be doing this? How does this make perfect sense? What might be underlying this? We might be curiously stepping into trying some acceptance strategies or some mindfulness strategies or some diffusion strategies or just something not what I'm doing. If you could help me not emotionally pick my scabs, that'd be great. So I think it's a fantastic question to ask. And what I love about it is it highlights sometimes clinically, like self-help or like in therapy, we might hit what feels like an impasse, where it feels like there's nowhere really to go. And this is a cool place that point highlights we can always pivot to something because it's all related.
Can I like I just want to operate. So again, like the question is like, can we use Socratic questioning on like a discrete like thought that
Mm-hmm.
comes up, like I'm a piece of shit, versus this pattern of
Mm-hmm.
thinking that you're
Mm-hmm.
observing across, let's say multiple instances of like awfulizing or catastrophizing.
Yeah, absolutely.
Okay.
Do we talk about how, or
I
you were just trying to say
I
this?
mean, yeah. Do you imagine like the intervention or the questioning looks different for these two types of like the content versus like the thought process or thought pattern?
Yeah, I think so. And I think also there's so much like overlap between like things where sometimes we might be talking about like comparing cognitive restructuring versus behavioral experiments, but like 70 to 80% of it is the same. It's like if you were to compare like CBT for generalized anxiety versus like CBT for like a specific kind of phobia, like there's a good amount of overlap no matter where you go. So sometimes we get so fixated on like language and categories that we forget like life is flow and there's a lot of overlap. So the process, right? The process of thinking with somebody instead of thinking for them, right? Thinking for somebody would be to say, hey, this is a distortion you're doing. This is a thinking trap you're doing. This is bad. You're committing a cognitive sin. You got to stop it. That would be as opposed to guided discovery, that'd be provided discovery. Guided discovery would be to say, hey, so I'm seeing this and I'm really curious about it. Like, help me understand. Like, this is what I'm observing. Are you noticing this as well? Like, how did you come by this? What's it like? What's it like to be in this? Right? You might be looking at like, what do you get out of this? What do you lose from this? You might be looking at like, what would you lose if you were to give this up? But part of it is just this collaborative kind of right seat, left seat. We're doing this together process. So in that way, Socratic questioning is sometimes not about logical positivism. Sometimes it's not about is this thinking, is this not true? Sometimes it's more about like how are we thinking? Which
Hmm.
Socrates, there were places where he was evaluating things specifically, but there were also places where he was focusing on just trying to teach what he would call virtues, we might call values, trying to teach people how do we live a wise life? How do we be curious? How do we just be good people and be kind to ourselves?
Yeah, and makes me think about the ability to self-validate too, being able to be curious and then understand and give ourselves compassion,
I,
right? As opposed to judging our thought or
I,
yeah.
Alicia, I'm glad you mentioned that because I do. So when I was initially introduced to CBT, like back in the day when I was doing my postdoc, I was like, "What is like this? This is this mechanistic. Like, what is this thing that's just like
Uh-huh.
change your thoughts?" Um,
Right.
and and I will say. And I realize in retrospect that this has always been in the mix. And one of the things that drew me to DBT was the acceptance slash self-validate, like the validation.
Mhm.
And I think Scott, to your earlier description in like that, in from your the like that approach of like understanding context, I feel like context is so important when we are trying to validate our experience and tell ourselves, oh, it makes sense why we feel that way. And I'm curious like how you weave in validation and compassion into the Socratic questioning.
Yeah, fantastic question. Love that. And I think it's hard because I feel like I have so many thoughts. It's hard because if there are like textbook ideas about like this is the way CBT is, and this is the way DBT is, and this is the way ACT is, but in reality, it's not as clean cut as that, right? It's not like there's again in a research way. If you're writing a manual, you're saying you can't do this because we're testing this out, but even then, from like a CBT perspective, if you have a conceptualization and you have some strategy that works, you can use any intervention that targets like your conceptualization. It doesn't really matter what you're doing, right? You can be big tent and it would still work. As Dr. Beck would famously say, if it works at CBT, it's just such a funny and ridiculous statement. I love it so much. I think CBT can be done really poorly if you do it in a highly rigid, purely rational kind of way. I think, but from my perspective, that's not CBT. Like I'll sometimes talk with people and I'll say, I really don't like CBT, and I say, well, which CBT are we talking about? Because there's different CBTs, and like no kink shaming, but like if it's for you, it's for you. That's fine. But if it's not for you, it's not for you. That's also okay. But if they say like I'm not into cognitive behavioral therapy, I'm going to say, okay, so what is it about it that you don't like? And if they say, well, it's too rational, and I'll say, well, that doesn't sound like CBT. Like it's not meant to be like being the thought police, right? It's not meant to be this place where we're trying to identify every negative, distorted thought and root them all out. That's bad CBT, right? That's like I bought a workbook and I trained myself, and the hard thing is there's all these common factors that go with being a good therapist, which has to do with like Rogerian accurate empathy and all these things, which are really, really important. Usually we don't focus on those on the manual because the assumption is people are already good at it. Right. So the idea is if you're writing a book, there's limited pages, and so you're going to focus on what's unique about the therapy, not what's universal. And so sometimes people pick up the book and they focus on what's unique and they think that's all there is, but the reality is there's so much overlap between like however any of us are doing therapy. We're one human sitting with another human trying to help them, trying to compassionately be with them. It doesn't work without empathy. It doesn't work without validation. It doesn't work without curiosity. The way that I work, right, to answer your question, where does it fit in? So I'm trying to lead with validation. I'm trying to lead with curiosity, both because I'm with somebody who's hurting, but also because it just makes my job easier, right? Like if I can listen empathically what's going on, along the way I'll learn the context. Along the way I'll learn things that I can fold in later on and say, I remember earlier you were telling me something about your dad, and you were saying these things, and that seemed kind of important to me. Which is going to be easier than me trying to say, well, here's a list of questions to ask you, and this list of questions is going to prove you wrong, because that's such a asinine way to do therapy. Dennis Greenberger, right, one of the co-authors of Mind Over Mood, he said something once, and it changed my life. Well, a lot of things changed my life, but changed my life. I was in this discussion with him, a lot of people were having a discussion about like relationship versus like technique, which comes up a lot, right? This idea about what's the most important part of therapy. And people are talking about like, well, evidence-based therapy, and you got to use strategies that we know work. And other people are saying, well, yeah, but like the data shows the relationship is the most important thing. Side note, there's that Lambert study people are always quoting showing that like the common elements make up the most, cover the most variance. That actually wasn't a psychometric finding. Statistically, he didn't find it. That was a logical finding. He intuitively picked that number, but people have cited it in a way where they've created this narrative that's like statistically what's been found, but it's not. He's never released how he found that number, which is interesting. Kind of like, I know this is an ADHD moment. Also, kind of like periodically we'll say your brain isn't fully developed till you're 25 and then stops developing at 25. That's not true. That's because there was an early study that only had participants up to the age of 25. and it showed that people's brain were continually developing, and then people cited it saying, well, your brain develops all the way up to 25, and then people started using that to say, well, your brain is fully developed to 25, but it's not statistically what's going on, right? When you learn the context, it's fascinating. Oh, I got myself off the topic. God damn it, what was I talking
Okay, wait.
about?
So what you were talking about
Yeah, okay,
was like how.
let me pull it back. Let me pull it back. I got it. Okay. Anyway, so there's this conversation about intervention versus relationship, and then Dennis like very pragmatically says like, well, you don't have to choose. You can do both. Like, why are we even talking about this? Like, focus on like being a compassionate, caring person who like sits with the person with their feelings and use strategies that work. Like, this is why are we talking about this? I was just like, this guy, Dennis.
Well, and I really appreciate that very much came across in your book, Scott, like how much, validation and just empathy and curiosity were in the dialogues that are in there. So it's a really nice, for anyone who's interested, I highly recommend reading that.
Oh, thank you.
Well,
I think this is a good question.
oh yeah, please go ahead.
I'm not sure we can, fully answer it, but any advice on finding a proper CBT or DBT therapist when you have a limited access to healthcare, money, etc.? I actually think, associates, postdocs, like training centers can be a really good option. I think that especially if they have good supervisors who are, actually really trained or certified in DBT or certified CBT therapist. Any other thoughts on getting low cost, like effective CBT, DBT, high quality therapy?
Yeah.
And then
sorry, I'm still jazzed about the previous question.
TheraHive, awesome.
Yeah. TheraHive is good. I like it. I like Open Path Collaborative. Is that what it's called? Open Path Collective, Open Path Collaborative, I think is a nice option for like sliding scale. Obviously, if you can find somebody who's certified by like the Academy or Linehan, that's fantastic. Of course, if we're talking about like limited access, limited means, maybe we're being or just like what's in your area. In CBT, there's an old strategy that has never failed me. So if you call, because it's easy to say you do CBT, but like you might not actually do it, or you might not know that you don't do it. There's a lot of people who say, yeah, I do CBT. What they mean is, I have a thought record that I use, which is not CBT. It's not the whole thing, right? It's just not. But if you call somebody and you ask them, hey, do you do interoceptive exposure? That is a highly specialized thing that only somebody who like really knows CBT will know what you're talking about, and you'll know pretty quickly. So if you're on the phone with them, you say, hey, do you do interoceptive exposure? And they say, what's that? You can say, great, all right, I think I got the wrong number. But if they say, I do, why? Do you need it? What's going on for you? And then you might say, oh, okay, well, this guy has like a good, this person I'm talking to has a good understanding of the basics of CBT. That's a pretty proven strategy.
I love that strategy because so much of mindfulness of emotions is just interoceptive exposure. Yeah, I'm going to start telling people to do that.
Yeah.
It's like in DBT, it's like, I feel like the suggestion often is to ask, hey, are you part of a consult team?
Yeah, fantastic.
Like that's always a helpful question to ask someone.
And foundationally trained or had,
Alicia, I want to give you, before I jump into any other questions, are there any other questions coming through on the Instagram that you...
Now, but please feel free to add questions. Anyone
I had a question while you're pulling it up. Here's my question for you guys. Okay, so DBT therapists are pretty famous for like being a little irreverent at times, which is maybe part of the idea. I'm curious from your perspective, do you see a difference between irreverence and sarcasm, maybe even irreverence, sarcasm, and irony? Does it matter? Or like is what's inbounds and out of bounds?
I love this question because it depends, Scott.
How dialectical.
Depends on my relationship with the client and their sense of humor, like, and what I know about them in terms of what they're going to respond to. Like with certain clients, I have used some sarcasm, but in a very playful, and like I'm using a lot of social signaling to, do it in a way that like shows I'm being playful. Because the idea of irreverence is to kind of like knock somebody off a little bit, like to kind of like throw them a little bit, be like, oh, wait, right? And then to kind of get them to think about what they just said or what's happening. So not, like, we definitely don't want to use it in a way that would be offensive or hurtful or like, you know, any way that might cause, I mean, a little offensive could be okay, but you know what I mean? Like you want to maintain the good rapport in the relationship.
Yeah, I think about like just the clinical utility of it. Like, what is the function of this thing that we call reverence? And Alicia, to your point, it's like we are trying to increase cognitive flexibility. I think, like Scott, this sort of like circles back to Socratic questioning and sort of what our broader goal here is, which is that folks can hold on really tightly to various types of thoughts and beliefs, and irreverence can function as this way to maybe potentially shift perspective. And so, any way that, like, anything that I can or say or do in a session, um, that will do that. And I think, Alicia, to your point, like, we can behave in such a way that our behavior becomes, let's say, so offensive that we're no longer targeting the thought. Now emotion is really intense. And sort of someone's sort of capacity to think flexibly is no longer sort of quote unquote online.
Okay.
So it's sort of thinking within that range. Like, how can I intervene within this range to shift perspective or help loosen grip on a thought?
Cool. I like it.
I mean, I yelled at a patient today. I spent a good
What do you
hour.
yell at them?
You know, um, in a playful way,
Like
Did they text
as
their ex?
I, but
I or about what you mean by yelling.
yeah, I mean, like I was being, it was a real,
Mm-hmm.
it was a real irreverent session where I was,
I mean, it sounds like,
speaking.
I mean, this isn't, you're not talking about being sarcastic though, right? You're talking about like radical genuineness as an intervention. You're saying
Correct.
like I came across as a, they got real Jesse for a moment. We said like, what did you do? What just happened? What's going on? Yeah.
Yes, where it wasn't sarcasm, and I was communicating at times my frustration
Mm-hmm.
in a really genuine way, and in a way that I was intending to do that, like that was clinically
Yeah.
indicated.
Makes
Like
sense.
being and it's the same thing with irreverence, like being
Mm-hmm.
radically genuine for the sake of being radically genuine. Like that's not
Yeah.
the intention. The intention is that this has a clinical import. And like, so in that moment, I was like, oh, this person is holding on really tight to this belief. Like, I need to act really dramatically in order to help bring their attention, like draw their attention away from that right now.
So you have good control over your masking abilities. I've lost all control of
Of
it.
over
It's just
my oh,
I'm just radically genuine all the time. I can't.
I
So from
don't
my
think.
perspective, tell me what you think about my take. Tell me what you think about this. So from my perspective, I think about like because sarcasm can be mean at times, right? And that's not the goal
Yeah.
of it. But irreverence to me seems to be like counter to this idea of reverence. And sometimes like when all three of us were in grad school, there were these lectures about like professionalism, and there were these old vestiges about like tabula rasa, blank slate, like have like a blank reflection, giving people an opportunity to, I guess, not bringing too much of yourself to the table in a sense. And to me, irreverence is kind of more like sort of a reverence for these kind of like ideas of these like sterile ideas for therapy, and perhaps irreverence is more about like showing up not necessarily in my white shirt and tie and suit, but like wearing like what regular people wear, and showing up like giving you real Scott, because that's sometimes like the most valuable thing you can get is
Yeah.
somebody saying that's hilarious. What's going on? This is crazy.
Yeah. And it basically showing a mirror, right? And reflecting
Mm-hmm.
back. And also, like, this is a relationship too, right? Your relationship with the client and their relationship to you is oftentimes like, oh, like this is happening here. It can happen outside of this room too, and like giving direct feedback.
Yeah.
I also think like what the function broadly of humor is,
Mm-hmm.
like comedy,
Yeah.
like it is to sort of recognize the absurdity of this. Like, we're here for a short period of time, and yet we hold on to some of these beliefs and things so intense. It's like it is a way of sort of loosening that grasp on some of these thoughts. And I think that irreverence sort of highlights that.
I mean,
Yeah, I think so. I love that.
Because I think my depend comment is partly like I have like certain, like in terms of figuring out like the humor of my client, like, if my client is super sarcastic and they find it hilarious, I might lean into doing like mirroring some of the ways that they talk as not only a way to join them, but then also kind of like speaking their language a little bit. Yeah.
Cool.
I'm mindful of time. Go ahead, Alicia. Yeah, please.
Are we running out of time? How much time do we have left?
We got about like 6 minutes.
I know.
And
6
Alicia,
minutes?
I know. Goes
I
by
had a
very
whole long
fast.
story for you. That was at least 7 minutes. It's just fine.
Alicia, we have a question.
That was some good reverence right there. Yes, this is recorded and we will post the entire live for those who have asked, and also if you're just tuning in or you want to see the recap of our conversation, you can watch it.
Do we have another question, or can I ask a question?
One question, but
Alicia, you go first with your question.
In general, like, how does someone get into, like, because Stoicism is such a broad topic, right? And you could go, I'll admit, I even like have gone down the Stoicism rabbit hole at different points. But Daily Stoic, I started listening to, and then there's like a big whole thing one can go explore. But if you were to recommend or point anyone in a direction, if they just wanted to learn about Socratic methods in general, like related to kind of understanding the foundation of Stoicism, or things that might help them maybe with questioning, getting kind of a sense of these practices.
Excellent question. And I just want to highlight for folks, when we talk about Stoicism, what do we mean? Because in modern language, Stoic might mean like having a stiff upper lip, being very British about things, being unemotional. That's not Stoicism. The idea of Stoicism is not to be unemotional, is to not be controlled by your emotions. The goal of Stoicism is functionally to focus on controlling what you can, which are your behaviors, figure out what matters to you in life, your values, and live a good life. So it's about being wise and not non-judgmental. Interestingly, CBT folks like Dr. Beck were focused on, is your thought true, with this idea that your thinking is affecting how you're feeling. The ancient Stoics, what they actually said wasn't that like you need to control your thoughts, but they would say you need to let go of your judgments. They would say these judgments are driving your strong emotional reactions, and if you can learn to be non-judgmental, you won't have these strong emotional reactions, and then you can have better behaviors and you can live a good life, which is basically modern acceptance and commitment therapy. Isn't that wild? Yeah, which is I think a pretty important difference. For somebody who wants to get into it, I always feel bad plugging my things, even like on my own page. But we wrote a book by New Harbinger, the Stoicism Workbook, which it initially started out as like a self-help workbook version of a Socratic Questioning book. So it has the last like 2 chapters, but really 3 chapters are focused on like how do you learn to do like a Socratic process on your own, and the rest of it walks you through like the essentials of ancient Stoicism and how does it relate to the modern challenges we have. There's like activities, and I poured my heart into it, and it's kind of my baby, and I love it. But there's a lot of good places to start, right? There's a lot of good podcasts that exist. You want to watch out for something we call broicism. Broicism is not Stoicism. Broicism is that catch flights, not feelings. No, you don't owe anybody anything sort of thing, which is not exactly what Stoicism is. But I'm a big fan of Donald Robertson. Everything he writes, I love a lot. He wrote How to Think Like a Roman Emperor. Casey Rice is with us. She co-wrote that 365 Ways to Be More Stoic is also a fantastic book. If you like the Daily Stoic, check out 365 Ways to Be More Stoic. It's fantastic. She also helped co-write Stoicism Workbook, and it wouldn't be as good as it is without her. And so I'm very grateful to her for that. Did I answer your question? I feel like I just started plugging things and I got them.
Okay. And I'm
your last question.
No, my last question was about mechanisms of change, and I'm
You think that's
realizing we've
for the
got.
very end?
I know, I know, but I kept on
Last
using
last
like
question. What's the
psychological
meaning of
cognitive.
life?
What's the meaning? What's therapy? Um,
42.
and I guess on that note, all that means is that we have to do this again.
Yeah.
So for part 2, or you can hear Scott talk about the mechanisms of change behind Socratic questioning, you'll have to tune in for another time. Scott, I
Yeah,
just
I gotta do some
wish
research
you
on
do
this to
part
figure it
2.
out. Okay.
Well, thank you. Thank you for
Thank you all.
Thanks, Scott.
this is great.
Yes,
Are we?
thank you, Scott. I think this is it.
This is
So
it. We
if
did
you
it.
could,
All right. Way to go.
We did.
way to go,
Roll
team.
credits. This is,
I guess last minute things, Scott. If there's anything, this is what they say at the end of podcast. Like, if there's anything that you want to promote, where can people find you?
oh yeah, yeah. I have a Instagram, Socratic Method CBT, which I think will be tagged in this. If you're watching this, you're already there. You can find me there. You can find me in real life in Texas, but please don't come find me. That'd be kind of weird if you approached me randomly. Can I share one last
Yeah.
thought?
Yeah.
Is that okay? So Epictetus is my favorite ancient Stoic. A nice contrast. So Marcus Aurelius, the Stoic emperor, somebody who has like a lot of control. And sometimes when I'm teaching about Stoicism, people might say, well, if you're the emperor, it's easy to like say control what you can, let go of what you can't. You have a lot of options. Epictetus was born into slavery, was a slave for like 30 years, was um, uh, wounded in a way from one of his slavers in a way where he walked with a limp for his whole life. After he was freed, he wandered into a lecture hall. Gaius Musonius Rufus, one of the most famous lecturers of the time, was lecturing, and Rufus met Epictetus and took him on as a student, and Epictetus became one of the most famous philosophers of his time. He has a wonderful quote, which I think is a nice message to hold on to, where he says, every situation has two handles, right? If somebody has wronged you, don't grasp the handle that this person has wronged you, because this isn't the handle that can lift. Instead, grasp the handle that this is your brother. This is the person you came up with. This is the handle that can lift. And I think that idea that every situation you're in, there's more than one way to approach it. And if you're trying to approach it from a place of wrath, from a place of anger, that's not going to improve the situation. If you can approach this from the place of shared connection, that can lift.
Hmm.
Therapeutically, usually we turn this in ourselves and we'll say, if I'm not happy with what I'm doing, I can't beat myself down and lift myself up at the same time.
Mm-hmm.
If I want myself to do better, I got to hold on to this compassion for myself and remind myself that, I've been through a lot together with myself and I'm going to keep at it and then lift myself up along the way.
Nice. I like that.
Yes.
I had now it just that percolated a whole bunch more questions. So maybe
Let's
we
keep
can
going.
another one.
Okay.
Because I
I know.
want
You got sessions.
to
You got
more
sessions.
now and the self-inquiry and self-forgiveness lessons in I don't know how familiar you are with RODBT, but I mean it's
Ooh,
very similar. Like,
yeah.
but a lot of self-inquiry stuff that also kind of feels in line with overlap. With
Cool.
Um, Again, Scott, thank you so much. For folks listening, check out TheraHive. Jesse talk is good. Alicia, anything you wanna?
Yeah, just that. I mean, for TheraHive, we are enrolling both in an advanced DBT group now, as well as our regular, DBT skills course where you can learn the skills affordably online, blended learning model. So yeah, check it out.
Cool. Thanks,
Cool.
folks. Bye.
End of session wave. All right.